Hello, everybody. Thank you for joining us today. We have a very interesting case, and I would like to show you and I would like to share with you this case. I would like to invite you to join us during our live transmission that will be held on September for the National Gastroenterology Society here in Ecuador, and with the international faculties also to join us in Dominican Republic in a few days, and join us also in Washington and Orlando for some lectures, and don't forget to join us also in the live transmission for US Skyline, that is the global meeting of US with more than 20 centers worldwide, and live transmissions from different centers of the world. So will be a very interesting live case demonstration. So we will participate with some live demonstrations. Thank you to Dr. Alberto Largi for this kind invitation from Italy. So today I would like to show you this case. This is a very interesting case. This is ¿cuántos años tiene el paciente? This is a 54-year-old male with a history of abdominal pain, and they perform abdominal ultrasound and a CT scan and show with a cystic lesion. So this patient didn't have any pancreatitis, just have this cystic lesion and start to perform some discomfort in the abdomen, in the upper in the epigastric area. So they sent to us because of the cystic lesion. And what we have is that sometimes this macrocystic lesion could be, many things, huh? Could be, cystic serous lesions, mucinous lesions, and could be another kind of lesion. So it's very important to have a very good evaluation before to take any kind of decision with this patient. And until now, we have, many kind of different techniques that we can use. We can use fine needle for sure, aspiration of the liquid, and send to evaluate this. And this is important. Always do it because it's cheaper. And but also we have contrast enhancement that we can use to evaluate the wall. You need to remember that the cystic lesion normally have hypercaptation because there is a lot of vascularization on the cystic wall, so you can use that. The other thing that we have that is with high sensitivity and specificity is confocal endomicroscopy. That is there is a paper that we've already we performed with many other centers, and we have very good results, and it's also something that you can use if you have in your units. A little bit expensive, but more, with really high specificity and sensitivity, and with very high accuracy. But you also have biopsy forceps through the needle. So we have all these kind of things to evaluate the lesions. And from my personal opinion, I believe I'm not an expert, probably. Probably the guidelines say the contrary, but I believe we perform a study that is already published in World Journal of Gastrointestinal Endoscopy, I believe, where we evaluate retrospectively 140 cases of cystic lesion, macrocystic lesion, and what we saw is that the B mode that we are looking now here endoscopic ultrasound image, this black and white image, is not enough because the probability to have a mistake is around at 50%. Even if we have the characteristic that has been already published during years, but because at that moment we didn't have good correlationship, and we didn't have a good technology to have a very good assessment to this kind of cystic lesions. So, but what we saw is that when we added different technology, moreover, when we added confocal and when we added micro biopsy forceps through the needle, we had and we arrived to had in around the 90 to 95% of accuracy of the cystic lesion as histology diagnosis. So it's in our center is a routine to do it both because we increase 34 more diagnosis that only doing the aspiration of the liquid and sending that. This is important also, is we already do it also, but all this you increase a lot the diagnosis. But today I would like to show you one new technology that is already well, it's a new software that is the DFI. Raquel está aquí, ¿no? ¿Cómo es el detected flow image? Is a new technology from Pentax Medical and and Itachi Aloca. So the this can measure and evaluate the microvascularization. So what we will use is just to put to push, and I will show you first the characteristic of the DFI of this lesion, and you can see here very well the lesion characteristic of the wall inside the lesion. So this lesion is a macrocystic lesion with different, with walls inside, and all these walls have hypercaptation. Okay, so this is very interesting because, to my opinion, okay, for the even being a macrocystic lesion, and for the characteristic of the contrast or the microvascularization with DFI that is similar to contrast, this lesion for sure is I believe is a serous cystadenoma, because serous cystadenoma normally have more vascularization. Okay, so this is very interesting. You see the quality of the image is really well, it's beautiful, huh? I have to tell you, it's really beautiful. So so I invite you to join us and to follow us in our channel. You see here, I will put you see here very well. This is very nice. This is very nice image. You see, so you see the wall. You see the wall inside the cystic lesion, and you see the hypercaptation. The microvascularization of the wall. It means this is a very good image, and I really love it. This image, I will record it. This is really nice. So beautiful image, so good correlationship, and this is for sure the future of let's go to see again the future of how we'll deal with this with this new technology. I believe is really interesting, And also we can see um, you know, in 3D the quality of the image, of the vessel, of the wall, the microvascularization, but with the 3D characteristics of the of the vessels, and this is very nice. I really uh, I am very surprised of the characteristic of the lesion. So this is very promising technology. We are under evaluation of this for pancreatic masses and cystic lesions, so and subepithelial lesions. So we will see what will be the future of this. Let me reduce the image. So let's see what we have here. You see, the correlationship is very similar. So you see, it's very similar. We see here exactly the wall, and we see here that there is microvascularization. So that is normally it's impossible to see. I will change to the Doppler, and we see the Doppler here, and we don't see. We can see with Doppler, but with the detecting flow imaging in the DFI, we can arrive to see very well. That is very nice technology. So now I will use Confocal. Please, can you give me the needle? And I will try to go inside, the lesion, and I need to evaluate the wall. Okay, so now I need to retire this. I'm sorry. And then I will use microbiopsy forceps from Steris. Okay, so now I have my needle here. I am inside. I am very careful because this could bleed. So I will advance my confocal. I will increase my image. You can see here my confocal probe. And I need that you put, por favor, pongan en grande la imagen del confocal. So now we see very well. So the tip and the trick with confocal is not to go too deeper, to try to see very well. Ya tiene la fluoresceína, ¿verdad? I would try to change the position a little bit. Try to see. You see now. You see very well. So I put the. Ya tenemos el confocal en grande. ¿Está en grande? Okay. So we see the vessels very well. So I don't see mucinous characteristic. I see serous cystic characteristic, and I believe this is a serous cystoadenoma. So this is for sure a serous cystoadenoma. All the characteristics very very clear, and I I am 100% sure with the image that I am having from this confocal. So I will not take a Murray biopsy forceps because I will have some bleedings. I will just retire my confocal, and I will try to see just to take a liquid just to have more details from this cystic lesion. Okay, so I will cut my transmission today. I believe we have very clear with DFI and confocal, and I would like to thank you, and waiting for you for next live transmissions, and inviting you to continue supporting us and continue to subscribing in our live endoscopy channel. Thank you so much. Cortamos la